Are you concerned you drink too much or struggle to stop drinking? Let's explore the truth of alcohol abuse, and by the end of this video, you'll have a new understanding of alcoholism. Hi, I'm Mark Cooper, board-certified gastroenterologist. I spend a considerable amount of my practice discussing liver disease and with patients they're drinking. Patients often feel an immense guilt to disclose their true drinking. They may deny drinking at all, only later to disclose they have a couple of martinis at a sales lunch. For them, that's like it's not drinking, it's their work. But your liver counts it the same. In a video linked below, we have information about how to count drinks. Here we're going to talk about how to identify if you're drinking too much and what risk you have of alcoholism. How common is overdrinking? About 1 in 3 to 1 in 4 people will overdrink sporadically, but almost 5% are routinely overdrinking, and they can suffer long-term health consequences. So how do you know which risk category you may fall into? We offer you 2 questionnaires that have been validated to be very accurate for identifying people that may be at risk of alcoholism. The first is called the AUDIT questionnaire. The second is the CAGE questionnaire, and they're linked below. The AUDIT questionnaire is a comprehensive set of questions to identify patterns of overuse and how that's impacting your health. The first questions will ask how much you drink, and when answering that, it's important that you consider the standard drink. We define that in the video linked below, but to recap, that's a 12-ounce bottle of beer at 4% alcohol by volume. It's a 5-ounce glass of wine at 10% alcohol by volume, or it's roughly a shot of liquor of 70 proof. As you proceed through the questions, you'll tally up a score, and at the end of the questionnaire, that score will assign you to a risk category. Anyone who drinks is going to be at least a low risk. From there, there's moderate and high risk use. And lastly, there's likely addicted. What does that mean even to be an alcoholic, addicted to alcohol? It means that you have a general preoccupation with the use of alcohol and difficulty stopping it. And that has negative impacts on your life. It affects the way you work, your relationships. It can cause trouble with the law. So if you've had red flags like a DUI, or if you've had relationships broken that you need to mend, these are all very big red flags that say you may be an alcoholic. And that's what our second questionnaire, the CAGE questionnaire, goes towards. It's an acronym. C, cut back. A, if you feel annoyed by someone speaking to you about your overuse. G, do you feel guilty about how much you're drinking? Or E, do you have an eye opener, which suggests that you have a physical dependence on alcohol? These questions, if any of them are positive, then that's a strong suggestion that you are already at a relatively high risk for alcohol abuse. What if you're not here for yourself, but you're concerned about someone you love? Well, then you want to be looking for the signs and symptoms of alcohol overuse. If you have a person you're drinking with and they seem to handle their alcohol really well, keep in mind that that tolerance is built because of overuse. And so this is a person that may have trouble with alcohol use. There's also telltale signs of withdrawal, irritability, mood changes, things that would look like depression. People also tend to have a loss of appetite as they start to heavily drink. And so while alcohol is very caloric, they may not necessarily gain weight. They may almost lose it because they're going to lose muscle mass, because very severe alcoholics will replace most of their consumption of nutritious food with just calories coming empty from alcohol. Particularly challenging is that people that abuse alcohol can become defensive when approached about overuse. And so if you are concerned, then help engage a physician or a mental health provider that can maybe help facilitate a conversation with the person you care about. If you took the questionnaire and you scored in the addiction likely category, I want to commend you for taking this first step and encourage you to take the next step, which is to reach out to a health professional who can help you with this problem. Just as it takes courage to receive a diagnosis of cancer, it takes courage to face alcoholism. And so I thank you for seeking out this video and taking the questionnaire. I hope you found this information helpful. If you did, please subscribe to see our continuing series on alcohol use. Thank you and be safe.